FDA's new risk evaluation and mitigation strategy for opioids requires the makers of opioids to provide education and guidance to healthcare providers. A report in PainMedicineNews.com states the enrollment in this type of education by healthcare providers is optional. Speaking at the Institute for Safe Medication Practices webinar, Dr. Lewis Nelson had this to say about the new opioid risk evaluation mitigation strategy. Prescriber and patient education alone will likely prove insufficient to assuage the concerns of patients with chronic non-cancer pain who fear the reduced availability of opioid pain relievers and public health advocates who fear the excessive use of these drugs. Dr. Lewis went on to say that he believes the REMS approach could be an important component for addressing the opioid epidemic in the United States. Arizona pain specialist Dr. Paul Lynch had this to say about the FDA's new approach to educating physicians about treating non-cancer patients with opioids.
We have a long discussion of risks and benefits with every patient that's going to be on short-acting or long-acting opioids in our practice, and we make sure to use the word death several times in that discussion because I think it's kind of glossed over sometimes that these drugs truly do have a risk of death. When there's 16,000 deaths per year out of 8 million Americans taking pain pills, I think it's something that we're required to discuss with every patient. That's what we do in our practice and what we'll continue to do. And I'll be excited to see what education comes out in the spring.
Dr. Lynch also said Arizona Pain Specialist seeks to educate others with their 12-step opioid protocol. You can find more information about that protocol on their website, arizonapain.com. Now it's your turn. We want to know your thoughts, so please comment under this video and join in on the discussion. For Pain Chronicle, I'm Kristen Wesley with your daily dose of pain news brought to you by PainDoctor.com.